Well, I'm going to laugh because you know that I can't even say suit or sweet, much more to pronounce the medication that she's putting in, and she's trying to get me to pronounce it. Oh my goodness, it's so hard to pronounce these difficult words of the medication that they're giving me, but I'm trying. I'm not very good at pronouncing things because as I was saying to her, I've got tight tongue and it's really difficult sometimes. And then you've got foggy brain through all this infusion, chemo infusion in your brain. I didn't have a good brain before chemo, much more now. But anyway, see with me, guys, in everything, okay? Just see with me. But you know, each time I go, the nurses are really wonderful, as you can see. You know, they bear with me and all my faults. And this is the ward that I go to, just to show you. Okay?
Make the video, yeah?
You speak again. You take care now. Yeah, I'm showing you the drip. They're gonna take that out, I hope, today, as I was saying.
I'm hoping they're gonna
You
take
know,
this out
I've
today.
kept that in for
So
how
this is
many
what it looks
weeks.
like.
But you know, it had to be done.
So I'm getting the nurse to just film me because it's very difficult doing this. So there it is.
Everything went well.
Thank you.
You know.
What's your name? Cherry. No, my
I hope
sister
you
in
will
Jamaica is called Cherry.
send me a little
Thank
message.
you, Cherry.
And subscribe and share to others that will encourage those who may see it and are going through the same thing as I am. This is the machine, you know, that I'm connected to. Yeah. I went all over the place with the camera because it's really difficult holding the camera and also trying to do what I'm doing, you know, but never mind. I'm not professional, as you can see. I'm just doing the best I can. But love you guys, and whoever is seeing this and they're going through what I'm going through, remember that God is love and He'll see you through. We'll come through. Be courageous. Be positive. Bless. At this stage, the machine is bleeping, and when it bleeps, it stop pumping. You know, so the nurse has to come. So that's why I'm sitting, just waiting for them to come to start the machine again. I look so miserable, don't I? Sometimes I am miserable, a miserable soul, but never mind, you know. Oh, but you know, life is like this. You go through many different stages in life, and you just have to take it as it comes and just do the best you can, and that's what I'm doing. I'm doing the best I can. And anyone out there, just you're doing the best you can. I'm touching my weave. This is a weave cap because I haven't got no hair underneath, guys. Lost all my hair. And as you know, I work and I make weave. So this is a one I made many years back, and it's quite old. And it's come in handy right now. So, but when I'm finished my treatment, I'll make some more, and I hope my hair will grow back. And I'm sure it will grow back. It will take time, but you know, with God, all things are possible. And as you're still alive and you're still healthy after all this, that's the main thing you must concentrate on. You know, get yourself healthy again and look after yourself. Can't I'm not my appetite is not great because I've got no sensation, taste buds are gone, smell is gone through the chemo, you know, but they said it will all come back. So I'm hoping it will. So I'm just trying to be positive with everything. It's not easy. I'm not going to lie to you. It's not easy, but I'm doing the best I can, as I said before. Just keep praying, and that's all I'm doing, and encouraging myself each day, and all my family and my friends that come. Look at my mouth. They're talking about pain. I hate the pain that I get. I hate needles, so I'm not very good. All these needles being pushed in me, you know, it's horrible. And they know me. I sometimes I'm screaming when they're putting these needles in me because I can't stand the needles. I can't stand it. After all this time that I'm going through, I should be able to bear it. You know, I've got sickle cell anemia. I've got to go for blood tests all the time. So I should get used to it, but I just can't. I hate needles, guys. I hate needles. So that's why you see my mouth and my face is the way it is. You know, because they're asking me, am I allergic to anything? And I told them, I'm allergic to pain. I don't like pain. I really don't like pain. And they all know that. They all know me because when they're pushing this needle in me, you know, it's... But never mind. I'm doing the best, as I keep saying. Keep the faith. We'll be there. We'll get there. When you watch this, guys, send me a little message. You know, by the time this has come out, I would have gone through all my chemo, all my radiotherapy, and now just getting the injection in my legs. You know, because it's each time I go every 3 weeks to get the injection infusion in my leg, and that is the most painful one. Honestly, it is very painful. I'm just doing this, showing you the ward that I'm on, and you know what the procedures are, and I'm not very good at explaining some things, but I'm trying my best. So just see with me, you know, just see with me, bear with me, I should say. Love you, love you. Look after yourself until we peak again. All the videos that you're gonna see from now is from July, yeah, July, August. The next video that I'll be putting out, maybe you'll see that I've finished everything apart from my injection that I get in the leg. I'll put a video out on that as well, you know. Yeah, I'll put one out on that. I'll show you that. So take care. Bye. Subscribe and share if possible. At this stage, I'm just moaning about when I'm at work, you know. I'm sorry, but, you know, it's just that sometimes, because I do sometimes I have to do two, my job criteria is like, sometimes I'm in DSS classes, most of the time I have to order products and stuff like that. And I'm just groaning, and moaning how sometimes people complain, you know, and they don't realize that everybody's got their, you know what I mean, faults, and just like them, when it's their turn, it's a different story. So just forgive me about moaning, you know, just having a little moan. Just moaning and moaning and moaning. See my mouth when I'm moaning, yeah? Oh, love. Again, the camera is all over the place because I'm moving around. I'm moving, you know, showing you my face. I had infection, you know, when I had infection, I had a lot of sores in my mouth, on my tongue, in my throat, in my ears. There was a time I couldn't hear. I lost my hearing. I had buzzing in my ears from the chemo, you know, all the damage that it did to my body. But I guess I'm lucky because it could have been worse, isn't it? It could be worse, you know, but, you know, all these things are just minor. You know, my skin will clear up. You know, I've had to use pencil to make eyebrows because my eyebrows all gone, my eyelashes all gone. Everything went, you know. You lose all the hair from your body, up your nose, you know, everywhere, and with chemo. But they said it will grow back, so as I said before, you know, I'm sure it will. You know, showing you my weave. You know, my weave cap is a bit dry, you know, a bit dry. But, you know, compared to everything, I think I'm not looking too bad. You know, I've come through all the infection and all the bad times. I'm getting there. Yeah, they're asking me, am I allergic to pain? As you can see my face, that I'm not very happy because one thing I can't stand is the pain and the needles. But anyway, you know, I'm just messing with them. But guys, in this, all these different clips that you're seeing, you'll see when I've gone for my line to be taken out. You'll also see me when I'm going for my infusion, iron infusion at the end, and at the end you'll see when they're giving me my injection in the leg as well, when it started. So it was a combination of quite a few things in these clips that you will see, and the nurses and all the different nurses that attended to me, you know. But at the end of the day, you know, it was all good. So all these clips are different times, different weeks. So that when I've been, I just wanted to show you different times.